My magnificently cursed scholars, cardiomyopathy is not one disease. It's a family of architectural disasters. The house looks the same from outside, but inside, one room collapses, one bulges, and one is bricked up entirely. Let's tour this ruin, shall we? The Trinity of Doom hypertrophic, HCM. Walls thicken like overcompensating bodybuilders. LV cavity shrinks, diastolic filling fails. Famous for sudden cardiac death in athletes, the Grim Reaper's personal sponsorship. Echo, asymmetric septal hypertrophy, MR, SAM of mitral valve. Gene, V-myosin heavy chain mutation. Dark roast. You trained for the Olympics, but your septum said nope. Dilated, DCM. Ventricle balloons out, systolic squeeze fails. Causes: alcohol, Coxsackie B, wet beriberi, doxorubicin. Think of it as a heart that drank too much, caught a virus, or was poisoned by chemo, and now refuses to adult restrictive, RCM. Ventricles become rigid concrete coffins. Causes: amyloidosis, post-radiotherapy, Loeffler's endocarditis. Filling blocked, diastolic dysfunction, but systolic may look fine. Basically, the heart is saying no vacancy. Mnemonic, hot, dilated, rigid, the three cursed rooms, the others in the mansion. Arrhythmogenic RV dysplasia, ARVC, is a condition where the RV wall is replaced by fat or fibrofatty tissue. It features an epsilon wave in leads V1 to V3. About 50% of cases involve desmosome mutations. We've met this villain before, the butchered beatbox of the RV. Peripartum cardiomyopathy typically hits in the last month of pregnancy through to 5 months postpartum. The risk increases with age and multiple gestations. It's proof that motherhood really does drain your heart. Takotsubo, also known as broken heart syndrome, is stress-induced and causes transient ballooning of the heart. Triggers include emotional trauma, such as hearing your crush loves someone else. Recovery is possible, but not before dramatic fainting. Here's a playful mnemonic to remember these conditions. Mothers break RVs. Secondary curses: infective, Coxsackie B, Chagas; infiltrative, amyloidosis; storage, hemochromatosis; toxic, alcohol, doxorubicin; inflammatory, sarcoid; endocrine, diabetes, thyroid, acromegaly; neuromuscular, Duchenne, myotonic dystrophy, Friedreich's ataxia; nutritional, beriberi; autoimmune, lupus; mnemonic, inspired ants; management snapshot, drugs include V blockers, ACE inhibitors or ARBs, diuretics and antiarrhythmics. Devices consist of ICDs and CRT. Surgery options include septal myectomy for HCM and transplant for end-stage disease. Lifestyle recommendations advise against competitive sports in HCM or ARVC. Here's a humorous pickup line. Are you my ectomy? Because you take the pressure off my heart. Complications: arrhythmias and sudden cardiac death, especially in hypertrophic cardiomyopathy and arrhythmogenic right ventricular cardiomyopathy. Heart failure occurs in all types, by different routes. Thromboembolism happens because stasis breeds clots. Valvular dysfunction is common, with mitral regurgitation frequent in hypertrophic and dilated cardiomyopathy. Mnemonic: hearts fall suddenly, Tragically. My adored heart hoarders, cardiomyopathy is the haunted mansion of medicine, hypertrophic walls, dilated halls, restrictive doors. Each room kills you differently, but all of them kill you beautifully. Remember the causes, the complications, and that some hearts break from poison, some from genes, and some from love. Leave your twisted reflections below, for I shall roast 3 comments in the comments section.